Welcome everyone to the HBHE Graduate Prospective Discovery Series event for 2021. I'm Brian Zickman Fisher. I am a faculty member in health, behavior, and health education here at the University of Michigan. And I also serve as the HBHE MPH admissions chair and have been doing so for what, 6 or 7 years now, something like that. Jackie's nodding her head. Yeah, it's been a long time. I'd like to welcome you all here. We're going to take a little bit of time today to go through our department, some of the things we think are things that you might be interested in. We're going to definitely hold some time at the end of the session for some questions. We will also be monitoring the chat. So we'll be putting some links in there. If you have questions for us as we're going on, please go ahead and put them in the chat. And we'll try and answer some things just in the chat. We'll try and answer some of them live, et cetera. But we want to make sure that if you've got a question that you want answered, that we can respond to it. And if we don't manage to get to everything today, if it's in the chat, we'll try and follow up with you afterwards and share resources or answers as needed. I'm going to go ahead and try and share my screen. Hopefully this screen sharing will work a little bit smoothly. And again, if something comes up, please don't hesitate to drop something in there so that we can all make sure to get your questions answered. Now, let's see if I can get this done right. We're all living in the Zoom world in which sharing screens is like a daily event. All right, present. Is that looking good? I'm seeing some heads nodding. Good. All right. So first of all, again, welcome. With you today are 4 people from HBHE. Myself, I've already introduced myself. I'm one of the faculty members here. Jackie, why don't you go ahead and introduce yourself?
Hi, everyone. I'm Jackie Cormany. I'm the graduate program coordinator for health behavior and health education. Some of my roles are definitely with admissions and recruitment. So if you have any questions about after today about the application process, you just want to confirm some things, feel free to check in with me. And I also wear other hats within the department.
One of them is answerer of most questions, since most faculty will turn around and go back and say, you should talk to Jackie because I don't know the answer to this. And she is definitely a key part of the student experience in our program. Kieran, you want to introduce yourself as well?
Yes, thank you. Hello, everyone. My name is Kieran Zakiris. I use she, her pronouns. I'm the director of the Office of Foundational Learning and Practice, or OFLP. We cannot think of a catchier acronym. So please let me know if you have suggestions. I work really closely with Jackie. We promote, positive student experience, facilitate your degree progress. And a big piece of that for our office is the internship, the applied practice experience, and the integrative learning experience. And we'll talk a little bit more about that in a few slides. I also wear many hats, as Jackie used the term. I also manage our alumni engagement efforts. And again, we'll visit on those alumni in a few slides as well. So thanks for joining us. And I look forward to speaking more with you this evening.
And then we also have, I believe, Meredith Mays, who is a second-year MPH student who's helping out monitoring the chat. I don't know if is Meredith on. You want to introduce yourself?
I think she's running a couple minutes late, so I'm not sure if she's made it on yet, but I will.
We'll let her pop in and say hi, at least via the chat once she gets on.
Exactly.
So our agenda for today, first of all, we just want to introduce the department. Who are we? What do we do? And what kinds of training and skills will you get if you come to HBHE? But we're going to spend a significant amount of time sharing who we are. Obviously, I can't share every last faculty member's interests, every last research project that's involved here, every last class that's offered within our department. But we're going to take at least a little bit of time to try and give you a flavor of the kinds of things that the faculty work on, the kinds of projects that are available here, the kinds of courses that we teach, just to give you a sense of what the culture and the atmosphere of HBHE is like. We'll also spend some time talking about what HBHE students become and the many different career paths that our alumni follow once they get their degree, as well as leaving some time for some questions. So first, I want to give you a brief moment. We have a brief recording from our chair, Dr. Cleo Caldwell.
Hello, I'm delighted to welcome you to the Department of Health Behavior and Health Education. I am Dr. Cleo Caldwell, the chair of the department. We are glad that you are exploring our program because we have a lot to offer in terms of training in the field of public health. We represent the social and behavioral sciences in the field of public health. Our faculty, students, and staff are committed to improving population health with a particular emphasis on reducing health disparities and achieving health equity and social justice. I'm sure you'll learn a lot about our department during your time with us. We hope you will select Michigan's HBHE program to continue your education. Please feel free to ask any questions you have now or in the future. Again, welcome and enjoy your time with us.
So as Cleo mentioned, what is HBHE? Like, we see ourselves really focusing on the role of social determinants of health, thinking about all of the different factors that influence social determinants of health, ranging from neighborhood and built environment, education, social and community context, and of course, that can be unpacked in myriad ways. The health and healthcare system and the disparities that exist in access, in exposure, et cetera, as well as economic factors. All of those things collectively are factors that influence the health outcomes that we see in society, and unfortunately, the health disparities that exist there. And so a lot of our work really does focus on this question of how do we understand the system so that we can understand how to intervene and change that, looking through the lens of the social and behavioral determinants of health. Now at HBHE, what you will get by coming here is training in thinking at that level. Like, we look at the individual level, the community level, and the structural level determinants of health and how they interact with each other. You will learn and get exposed directly to questions of, like, how do you design, how do you develop, and then how do you systematically evaluate intervention programs grounded in the theories of behavior change and grounded in implementation science. I come from a communication background. That's my particular specialty. You will also get some training in good communications practice and how to motivate people about health. Drawing, again, from a history of not just practical applications, but also theoretical perspectives about what works and what doesn't work in getting people to change their behaviors, about motivating decision-making, about motivating change. And a lot of that work is grounded in a very sort of community-focused approach. So we talk and we teach how to partner with communities to create solutions that are not just you go in and then you go out, but are enduring solutions to the kinds of public health challenges that we face in our society here within the United States and globally. These are 5 bullets that represent sort of the core 5 competencies that we think of as we provide instruction in as part of the MPH program within HBHE. So, key determinants of health and health disparities, applying social and behavioral theories to the practices, the behaviors and behavior change, applying good research and evaluation methods to health behavior interventions. Like, how do you evaluate whether you are successful or not in your intervention? Because there are many definitions of success and many potential barriers that may or may not be under your control. Evaluation methods is a key part of what's involved in knowing whether or not the intervention that you're putting forth is worth continuing, worth the money, the time, and the effort that has put in place to get it started. Obviously, that's all wrapped up in these sort of the pragmatics of planning and implementing and evaluating health behavior programs and health behavior policies. And again, I mentioned we integrate that. We integrate community engagement at all stages of this process. So as we move forward, let me talk a little bit about the curriculum overview. And we're not going to go through all the specific course wordings of all this particular required courses. I'll give you an overview of that. I believe we're going to drop into the chat a link to the webpage where there's more detail about the specific courses, both in terms of the core curriculum and in terms of the HBHE requirements. But let me walk through these. So the foundational areas are topics that every Master's of Public Health student, at least as we teach it here at the University of Michigan School of Public Health, gets direct exposure to. So evidence-based approaches to public health and healthcare systems, so the system structure, policymaking in public health and thinking at that systemic level, leadership and interpersonal skills, communication skills, and planning and management skills associated with promoting health. Now, that's the kinds of things that you're going to get in the required core curriculum. That's true for all Masters in Public Health in epidemiology, in nutritional sciences, in environmental health sciences, as well as health behavior and health education. What HBHE's core curriculum focuses on, and these are walking through your core courses, psychosocial theory. So what are the theories, the psychosocial theories behind behavior and behavior change? Core course in program development and community engagement. Core course in program evaluation methods. And then we also require all students to take at least one, and are encouraged to take more, in appropriate research methods. Now, these might be things like behavioral research methods, like how do you research behavior? It might be survey methods, it might be qualitative methods. One of our faculty offers a course in geographic information systems, or GIS, as applied to thinking about health behavior and health behavior programs, etc. As well as you must take at least one course in 2 other domains. One of them is applied health communications, making sure that you have the communication skills to translate the knowledge you have to the audiences you need to reach, whether they are professional audiences, community audiences, individual audiences, etc. As well as you must take at least one course in the root causes of health inequities. And in fact, HBHE offers a lot of different courses in that particular domain, and many of our students take more than one such course. In addition, the curriculum has a few other requirements that are more focused on the application side. So we have an internship requirement. Now, it's made a little bit more complicated with COVID, but we have an internship requirement, and we will be moving forward with that for future cohorts consistently, in which students spend the summer between their first and second years doing practice-related work in whatever context interests them. We have a significant fraction of students who, again, pre-COVID at least, were doing international internships. We have students doing internships very locally within the Ann Arbor, Michigan, or local Detroit or Flint area. We have students doing internships in other parts of the country. And again, a wide variety of types of internships, and Kieran can talk more about this. Government internships, internships with community health organizations, etc. As part of emphasizing your practice experience, however, in addition, you will be expected to create what we call applied practice experience, or APEX products. These are things that you create as part of your training for use in applied contexts. It's not just, oh, I wrote a report for my professor. Like, these things have to have practice partners where this will get use. There's also an integrative learning experience, a culminating essay that's part of your second year curriculum that is designed to help you think through all of the different aspects of what you're learning within our program, pull it together, have it make sense as a coherent whole to launch you in your future career as a health professional. In addition, many students take on various research or administrative roles. There's a lot of students who are working with different faculty members on their research projects, both within the department or within the school more broadly, but also University of Michigan is a big place, and a lot of people are doing a lot of research, and it is not unheard of for HBHE students to be working, for example, with medical school faculty who are doing implementation programs, research projects related to particular populations or particular conditions, and bringing their program design, program evaluation, their research method skills, and applying them directly in that context of the clinical faculty members' research. In addition, of course, we offer a variety of co-curricular experiences and initiatives. I can't possibly give you the breadth of them in the 5 seconds I'm going to spend talking about this, but I want you to get this message that, this is a school of public health. We are a community of people who are passionate about public health. And whether that's a day when you go visit a particular, do a public service activity, whether that's seminar series of experts being brought in, whether that's other kinds of co-curricular things that are part of the holistic learning experience. I think you'll find the University of Michigan School of Public Health someplace where there's a lot to do and a lot of people who are interested in a lot of things. Now, I do want to highlight a couple things. One is, in addition to what you are required to take in your core curriculum, one of the unique aspects of the HBHE Masters of Public Health curriculum is its flexibility. Like the core curriculum, both the foundational courses and the HBHE core is just over half of your total required courses. That leaves you a lot of space to take elective courses within the department or potentially within all of what's available to you in the graduate coursework at the University of Michigan. And we have a lot of students who do courses in other schools, social work, natural resources, public policy, just to name a few. We also have a significant number of students who pursue dual degrees. And that's a whole nother conversation we can expand upon, but I want to mention it explicitly because that's one of the things that flexibility does help to facilitate. Another thing I want to mention about HBHE, we don't have faculty who are, we do have a few research track faculty who are primarily research, but the majority of our tenure track faculty all teach, period. We all teach and do research. There are clinical faculty who do more teaching. There are research track faculty who do primarily research, but even some of them are involved in the advising. What you will find here is a community of people who merge the research side and the teaching side on a daily basis. And that is part of our culture. I have said it before, but I'm going to reinforce this. We have a community engaged approach to public health practice. You're going to hear in the faculty overviews a lot of examples of connections to community and an emphasis on practical experience. So to illustrate this, I want to run through a set of, I think we've got 6 short snapshots of some of the faculty research projects and play some clips from them, just to give you a window into the kinds of stuff that's going on at HBHE. So here's the first one. This is the Love Her Collective, and we're going to hear from Christy Gamarel.
Hi, my name is Christy Gamarel, and I'm a faculty member in the Department of Health Behavior and Health Education. I wanted to speak very briefly about the Love Her Collective. The Love Her Collective is a group of researchers and community activists who are working together to identify the needs of trans women of color in the Detroit metro area. The Love Her Collective is a partnership between the Trans Sisters of Color Project and the University of Michigan, and we began working together about 3 years ago, and we started with focus groups to identify community needs. Now we're doing a survey called the Transformative Survey, and we've been working on developing a program to help trans women of color heal from trauma. And we are very excited about this work, and we are more than happy to talk with you more. You can follow us on Facebook at the Love Her Collective to learn more and get involved.
So the next faculty member and next research area I want to highlight here is the National Center for School Safety. And Justin Heinze is an assistant professor in the department who's heavily involved in this project.
Welcome, everyone. I'm so excited to hear you're considering Michigan for your graduate studies. My name is Justin Heinze, and I'm an assistant professor in HBHE. I'm also the co-director for the National Center for School Safety. We're a federally funded training and technical assistance center. Well, what does that mean? What that means is I get to spend my time working with schools across the country to help them develop, implement, and test their school safety strategies. And that can range anywhere from mental health promotion to threat assessment teams to important questions like should we have anonymous reporting system and school resource officers within buildings. I love being an educational psychologist in an applied field like public health, and I hope you'll consider the many things that Michigan has to offer when making your decision. Go Blue.
I just want to mention one of the things that I take away from Justin's work is there's been a lot of different things that have been done about school safety in the past decade or so. The evaluation of them has been minimal. And this Center for School Safety has been really pushing forward this question of we can't just do stuff. We have to know whether it actually makes a difference. So here's another domain. This is about health equity among older adults, and in particular, looking at pain management. This is, so I don't have a video, a clip from Mary Janovic. Mary is an associate research scientist here in the department, but this is an example of some of the NIH-funded research looking at questions of like, how do we think about structuring chronic pain management among an older adult population, wrestling with the challenges of, how do we deal with this in a pandemic? What are the specific needs of an older adult population? How do we think about pain management in an era of the opioid, epidemic? All of these kinds of questions are things that Mary thinks about a lot and that her projects are designed to be working on. Next up, we've got a little clip from Ken Resnikow, who is a professor who does a lot of work on motivational interviewing.
What makes me excited about teaching MI? Well, I think there's really two things. One, it really helps students get jobs. It's a very powerful skill to have on your resume, and it's really helped many students throughout the years be competitive in the job market. And two, it's a skill that you can use not only at work, but really can influence how you communicate across all avenues of your life. The techniques such as reflective listening and pulling on change talk are not intuitive. They're not things that people generally can just figure out themselves. They require training and they require feedback, and this course provides that. So if you're interested in learning MI, consider our course. Runs in the winter every year.
I have to say, I've worked with Ken on a few different projects. In addition to teaching motivational interviewing as an individual counseling skill, he also does research work in implementing motivational interviewing principles into the design of health communication interventions. So for example, I know he's working with me and several clinicians related to a breast cancer medical decision-making intervention to help women make better decisions and manage their own emotional experience of being diagnosed and getting treatment for breast cancer. And he brings in that MI perspective in the design of the materials. Now I want to introduce you to one of our assistant professors, Rihanna Anderson, and Embrace, which is her project on African-American identity. Oops, hold on, I just went backwards. There we go.
So you know how when you were younger and you got the talk, right? So not the birds and the bees talk, but the talk, like put your hands on 10 and 2 when you're driving and you're getting pulled over by the cops, or when you walk into a store, take your hoodie off. Those types of talks. So in the research world, we call that racial socialization, or the different types of ways that parents and children communicate about race. So we've got 40 years of research that documents how there are some positive benefits of talking to your child about race. Some people think it would be scary or anxiety provoking to talk about these really real things that happen in the world, but the literature says otherwise for the most part. So as an applied psychologist, I thought, well, what can we do about this? So I have parents and children sit down to talk about this with a therapist over 5 weeks with the Embrace intervention. It's really exciting. I hope that you can take a look at some of our work, our website, and some of our videos, and to let me know if you have any questions or comments or anything that you'd like to contribute to it.
And then the last faculty member I want to, or faculty line of work that I want to mention is work by one of our clinical faculty members, Bill Lopez. He goes by Bill, his name's William Lopez, on the health impact of immigration raids. And he's got an award-winning book called Separated.
Hello, everyone. My name is Dr. William Lopez. I'm a clinical assistant professor here at HBHE, the University of Michigan School of Public Health. My work focuses on the health impacts of immigration raids, looking at both home raids and work raids. The book you see here, Separated, chronicles the lives of 3 Latina undocumented mothers after the providers in their lives were taken away during an immigration raid that occurred just a few miles from the University of Michigan. Why do I do this work? I do this work because I can bring my full self and all the tools that I've learned in public health to care for my family and for my community. I do this work because I have a deep-seated belief in health equity and because I want to write for, with, and on behalf of my community for the rest of my career. Welcome to the School of Public Health, and I look forward to speaking with you in the future.
So that gives you a sense of the kinds of different research projects and the passions that I think many of the HBHE faculty members hold for the kind of work that they do. I'm going to pause here and let Kieran jump in to give you a little bit of an exposure, similar kind of snapshots of some of our alumni and some of what they've chosen to do with their training.
Thank you, Brian. So hello again. As you've likely heard, the University of Michigan has one of the largest alumni networks in the world. And not only is our network large, it's extremely supportive and especially here in HBHE, really active. And so in the School of Public Health, our alumni do things with students like lending their time in our student to alumni mentorship program, which runs throughout the academic year. They lend their talent in guest lecturing, coming in on course panels, sometimes even serving as lecturers in the department, and their treasure in scholarship and internship funding. So just a few examples of this is a network you could become part of. You may already be part of if you've completed another program here at the University of Michigan. There's 17,000 alumni from the School of Public Health, and here in HBHE, I think we're at like a little over 2,000 at this point. So really wonderful group to join. Next slide, please, Brian. So there's a little bit of data on this slide, and there is a page on the website that contains some surveys that show what students do immediately after graduation. And so we can throw that one into the chat now or when I'm finished. You can see that immediately after graduation, HBHE alum find themselves in a breadth of job titles, sectors, and specializations. This PH can open the door to titles like specialist, manager, analyst, consultant, as an example of just some of the variety of titles. In addition to showing you what can happen right after graduation, we thought it would be really helpful to see a few alumni who are a few years out to give you a sense of what a career path might look like, as well as to shed some light on how the skills that we discussed in the curriculum section look in the career in the workplace. So on the following slides, we have a few again, spotlights and snapshots from some alum. The first is Abby Schachter, who is an epidemiologist with the Public Health Seattle and King County Health Department. So you can go ahead and play Abby's slide.
Hello, I'm Abby Schachter, and I graduated from University of Michigan with my MPH in Health Behavior and Health Education in 2016. I'm currently an epidemiologist at Public Health Seattle and King County in Seattle, Washington. During my MPH, I took a wide range of skills-based courses and participated in the Innovation in Action competition. I also conducted research applying behavioral science to public health interventions. After graduating, I moved to Seattle, and I spent 2 years as an evaluator for our homeless housing system before I started my current role as an epidemiologist in the health department in 2018. In this role, I would say I'm more of a social epidemiologist, and I draw extensively from my training in health communications and data visualization in order to translate complex concepts for specific audiences, including the public, our nonprofit partners, and policymakers. Our team focuses on everything except for communicable disease. We do population and community health assessment, including looking at the social, economic, and overall health impacts of COVID-19. We have a lot of work focused on maternal child health, as well as injury and violence prevention. We've seen during COVID how important health behaviors are in affecting our health outcomes, such as whether we decide to socially distance, wear a mask, or get a vaccine, as well as how much influence policy and the environments have in shaping our health, like health insurance, sick leave, and our occupational exposures. In HBHE, you will be equipped with the skills to understand how all of these factors come together to shape our health, and how you in turn can design messages, programs, and policies to help build healthier and more equitable communities.
Wonderful. So next we have Swad, who is an international public health specialist, and you can go ahead and play hers.
Hi everyone, my name is Saad and I graduated with my MPH in Health Behavior and Health Education in the year 2020. Yes, the year of the pandemic. My undergraduate degree was in healthcare management, so I honestly wasn't sure what route I wanted to take afterwards. However, when I got the chance to hear from professors and take a look at the required courses, the HBHE department is what I connected with the most and what I imagined my career would look like. In the positions I've held, I can probably say I've used nearly every single skill I learned from this program. Currently, I'm the International Public Health Specialist at an NGO headquartered here in Plymouth called Mercy USA. I work on ensuring our programs are effective in delivering health, nutrition, and water and sanitation hygiene services to people affected by conflict and disaster in some countries in the Middle East and East Africa. Although my day-to-day work varies, studying roots of health inequities, social determinants of health, and psychosocial drivers of behavior change really allows me to better understand the communities I'm working for and to adjust my approach accordingly. So for example, although we might have a similar project in, let's say, Kenya and Syria, the cultures are very different. And so that means that has to be reflected in the actual project. I really loved the variety of classes, both in size and subject. The smaller classes are where we got to have incredibly interesting conversations. And the professors worked really hard to make sure that we got practical experience in the class. So when you're learning about grant writing, you're really writing a grant in collaboration with the local organization. When you're studying qualitative research, you're conducting focus group discussions in Grenada with a public health action support team. When you're taking global health, you're paying attention to this new virus that's taken the lives of a handful of people in Wuhan in early January. And one of my favorite parts of the program is that it really allows you the space to add those experiences and even take classes from another school. So I took social work, policy, and even a pharmacy class just to explore those interests. So honestly, if you have any topic that you're really interested in or a social justice issue that you're passionate about, don't be afraid to bring it forward, and I guarantee someone's going to listen.
Wonderful. And we have just
Hi
one
everyone,
more.
my name is Saad and I
Hold on.
graduated.
Sorry.
I know it's kind of tricky playing these recordings. Thank you. So we have Shayla Wilson as our final example, who's the Director of Digital Strategy at Evoke Kine.
Hi everyone, my name is Shayla Wilson. I chose HBHE because I wanted to understand how to help people make healthier decisions and what goes into the behavior change process, ultimately helping people everywhere live healthier, more fulfilling lives. I'm currently the Director of Digital Strategy at Evoke Kine, which is a healthcare communications agency that works with clients across different sectors. So I've been able to provide healthcare communications for big pharma, nonprofit agencies, NGOs, and biotech companies. Since graduating from the HBHE program in 2015, I've worked in a few different roles. Immediately after grad school, I worked as a research scientist with the Department of Veteran Affairs, primarily conducting diabetes research in Detroit. I left that role after 2 years to pursue a health communications fellowship within the Division of Diabetes Translation at the Centers for Disease Control and Prevention in Atlanta. And then from there, I took a digital manager role at Evoke Kine, currently based in New York, and I've been here ever since. I learned many things during my time at Michigan in the HBHE program, but most applicable to my career has been how to develop health communications that resonate with different populations. I've worked tirelessly to make healthcare more equitable and accessible, and I would not be able to make these things happen without the knowledge that I gained from my graduate courses within this program. I'm grateful for the experiences that I've had there and the network that I've built because of it. I will forever go blue.
That's a sort of a perfect transition out of this section. Just wanted to add that you'll see LinkedIn information on these slides, and if you happen to miss it, please feel free to reach out to me. I can share how to reach out for these alum, as well as others in our network who are always happy to shed some light if there's a different interest or pathway or type of individual that you'd like to speak with as you think about HBHE. Thank you.
Thanks, Kieran. So I'm going to take the last few minutes before we pause for questions and just talk a little bit about, as the head of the admissions committee, about some things to think about if you're considering applying to HBHE. So I always get this question, like, what makes a good HBHE applicant? It's actually kind of simple. So the main thing, first of all, make sure you know our priority deadline is December 1st. That doesn't mean you can't apply after that, but that's when we're going to make sure that you're considered in the primary wave of applications, considered for most of our scholarship funds, et cetera. The main thing you need to talk about in your application is, why are you coming to us in the first place? Like, what is your purpose as a future health professional? Why do you want to go into public health? Why do you see a fit between what gets you up in the morning and what is available to you if you come to HBHE? That's what we're looking for. And we understand that there are many, many different pathways that lead to HBHE, not just academic pathways, but life pathways, whether that's from where you're coming from, what your work experience has been, what your health experience has been. All of that is relevant to making you someone who will be able to be an effective health professional and be a good part of our student cohort. So bring that experience into what you write about in your application. And as you do so, acknowledge your strengths and your weaknesses. Like, there is no one path, there is no one red flag that will make us go, oh, well, if they don't have that, then they're not going to be a good applicant. And we really mean it when we say we do a holistic application process. Now, this session is primarily for master's applicants. I've just got some information here if you're interested in the PhD. One thing to make sure of, you must have completed an MPH before applying to our PhD program. And in a PhD context, the key thing is to thinking about matches between your research interests and our faculty's research interests. Another key thing to say, we do not accept GRE scores. It's not that we don't, no, we're not going to look at them. We're not going to pay any attention to them. And honestly, this is not changing much in the way we have evaluated applicants. For some MPH programs, that maybe have been a big change as different programs have moved away from counting the GRE. It has not changed ours very much. Why? Because we do a holistic review that looks at your past courses individually and looks at your experience. The one thing I will say is that you may or may not have substantial quantitative experience. Now, every Master's of Public Health student has to pass biostatistics. If that's going to be challenging for you because you've never taken advanced math courses, or it was a long time ago, or your coursework in quantitative areas was weaker, our recommendation is go take a college algebra course and just go do it. Like, if you take it while you're applying, that's fine. Like, every year there are applicants I see that I say, their quantitative experience is late. Oh, but they're taking college algebra. Fine. As long as they do well in that course, we're good. Like, so acknowledge that and try to do something about it. We do sometimes conditional admissions based upon having someone complete an algebra course to make sure they're ready for the more quantitative elements of a Master's of Public Health program. But this is not a quant heavy program. And we certainly understand that many students are coming to us because they come from because they want to do more community engaged work. They want to do more qualitative work. They have lived experiences. Bring those to life, but also recognize that being a public health professional requires a certain degree of quantitative skills, and we want to make sure that you're ready for the kind of training that you'll get while you're here. So that's my last slide. Here are my email address, Kieran's email address, Jackie's email address. We'll make sure that those are put in the chat as well. I'm going to unshare my slides now because I hate having you see me in a little teeny box. And let's throw the floor open to questions and anything else that we want to bring up.
Hey, Brian, we had somebody ask if you could expand on that quantitative statement.
So there's what we have done in the application materials right now is put in a small essay box that basically asks you to write about your quantitative preparation. And if that's, I took these courses and I did well in them, fine. And if that's, hey, in my job, I was, doing data analysis and I was using this kind of program and I was thinking about quantitative data that way, great, share that with us. And if your preparation is somewhat weaker, that's the place to say, I recognize that I don't have much background on this, and this is what I'm going to do about it. And we will pay close attention to it as we go through our application review. Let's see. Jackie, you want to call out questions, or should I sort of go through the chat?
Yeah, there's another question from a prospect that says, how many students can be admitted to the program?
There is a theoretical limit, but for the most part, we are operating on a principle. If we think you can succeed here, we are likely to admit you.
All right. Now, Ann asked, can you talk a bit about the executive public health degree / program?
I'm not sure I know what you mean in terms of the executive program. If you're talking about the online MPH program, which is, we refer to it as online, that is a related but school level program in which faculty members from all of the different departments contribute. It is, it's an online only program. It's done with the expectation that people are working while they're doing it. It has both overlap with the MPH program for HBHE, especially in terms of the core curriculum, like we're covering the same things in the core curriculum. But it also is a much more structured program. So there is more limited opportunities for elective courses. There's particular HBHE oriented electives that are available to the online degree students, but not anywhere near the full range that is available to the residential students.
I'm not quite sure what this is, but Hannah asked, does this program give you the qualifications to take the RDN certification exam?
So I believe that refers to registered dietitian, and our program does not. That you would want to go to the nutritional sciences program. And that question, I cannot speak for their program as to which. I know some of their students will be ready to take the RDN exam. I'm not sure whether all of theirs, whether you have to take a particular program or do special training in addition. But anyway, that's for that department. We do not offer that.
Okay. Maddie asked, can Dr. Sigmund Fisher elaborate more on the summer internship requirement? It sounded really interesting. This might be you, Brian, but it might be Kieran.
Yeah, I was going to punt this one to Kieran because while I could talk about it, Kieran is really the person who works closely with each and every student as they're working through their internships.
Yeah, absolutely. So the internship program is typically completed in the summer between the first and second years. It's typically somewhere around 6 to 8 weeks at an organization, although that varies because we have quite a long summer here at Michigan. Our calendar is something like 4 months long. So you can actually really engage for a longer time with an organization if you would like. And so as we've talked a little bit in the chat, you can go anywhere in the country, in the world for your internship. We have many connections in our local communities in Washtenaw County, in Detroit. However, students travel again throughout the country. They go to CDC, they go to other universities, they go to DC to work on policy, or they travel abroad. And so we found that the best model for internships is that students apply sort of like a job search, that you are planning to come in to apply for internships to find the best fit for your interests and goals. And we have alumni that share opportunities, we have partner organizations, and we also, again, encourage you to look like in our internal job posting site and for programs that are facilitated throughout the country for internships. So we have what's called the abstract book, where students will write a short summary of their experience. And I'd be happy to share that over email with anyone who wants to review just the incredible breadth of things that folks are up to. It's been changed and challenged a little bit by the pandemic, but we're seeing really creative remote opportunities. As you even heard in some of the alumni recordings, folks are working already on COVID vaccination and other things really on the ground. What else? I think that's a good general overview. The applied practice experience is something that can be done in conjunction with your internship. It may also be completed separately or in multiple experiences. So that's, I guess, another point there is to say you may focus on research for your internship and then partner with a community organization to create infographics, an evaluation plan, a social media campaign as something during the semester based on an urgent need that comes up that gets shared with our students, and you get paired up. So those are some other examples of ways that students fulfill those requirements. Happy to answer more questions that maybe came from anything I said too. So I'll let us move on to the next and revisit anything else that came up.
So let me quickly answer Juliana's question about the quantitative preparation. So is college level statistics sufficient? Assuming you did well at it, yeah, we think of that as being another piece, another sort of standard course that many students take that shows that you're comfortable doing algebraic operations and things like that. Sufficient is the wrong word here. Like, more is better. But the goal here, I mean, I'm being very transparent. For some of you, the goal will be, we want to make sure you're not going to hit biostatistics and crash and burn. Like, so, if you took college statistics and it was 4 or 5 years ago, maybe bone up on it. Maybe take an online refresher course over the summer. Things that will make sure that you're used to working with those kinds of mathematical operations again. If you want to move to doing more quantitative research work, like if that kind of experience is something that you want to build as part of your professional skill set, then a basic college statistics course is the entry point to that, but the more that experience you have, the more that you're going to then be able to build on it while you're here, whether that's in taking courses or in doing more quantitative roles, say working with faculty members on their research. So yes, that's good, but I don't want to say, check that box and you're done.
Michaela asks, how do you best express your purpose in the statement of purpose? What does the admissions committee want to know?
I know it's going to sound overly simplistic. Why are you coming to us? Like, tell me your story. Like, I see stories of people who are motivated by the health disparities they saw in their community or in their family. I see stories from people whose job experience they got passionate about. I see stories from people who really have known from day one that they wanted to be doing, let's say, work on particular health conditions. Great. But what I don't want to see is just sort of the abstract, I want to be a good professional. Like, we all have our own personal stories. I can share mine, like now's not the moment for it, but I can tell you what motivates me, what gets me up in the morning. And it comes from my own health experiences and recognizing that even given all the advantages that I have, I had to make incredibly difficult health decisions, and it shouldn't be that hard. And so my communications work focuses on not making it that hard for people in their moment of need. What motivates you? Share that with us, and you will go a long way towards convincing us that we're potentially going to be able to offer you what you need to move forward as a health professional.
Okay, Melina asked a really important question. Are separate applications needed for scholarship fellowship opportunities?
No. Well, let me asterisk. The School of Public Health, as part of our applications review, will consider your application and make a decision about whether to admit you, and then consider you for scholarship funds that are coming from the school and from the department. That is not financial aid, right? That is a different thing. So financial aid applications are done differently, and Jackie is the one who can speak more to that than I can. But no, you don't have to do anything separate to apply for scholarship funds.
Mm-hmm. There are different one thing I want to be clear about, some of you may see something as you're doing your research on our university and about the program is the Rackham Graduate School. Now, Rackham is like the main graduate school for the whole university, but it's mostly for MS and PhD MA programs. Our school is a professional degree program, so you're not going to be able to qualify for some of those fellowship opportunities you see listed there, unfortunately. But I do want to say that many students will apply for maybe teaching opportunities, which we call graduate student instructors. They're very competitive, that's for sure. But if you are lucky and receive one of these positions, you will have your healthcare tuition and a monthly stipend for that semester. That's something you'll want to research frequently and early for the upcoming semester.
And I'll add one thing to that, which is the teaching opportunities or teaching support opportunities within the School of Public Health are one thing, but a non-trivial number of our students are, as a graduate student with expertise in, say, psychology or women's studies or some other fields, have been able to be taking on those kinds of graduate student instructor roles in other departments on the university's campus. And we don't care where you are. If you have that role, then you get all of those benefits that Jackie mentioned.
Let's see. Lily asked, is there an interview process?
There is no formal interview process for our MPH applications. I've seen a couple people talk about the certification question. Let me speak more broadly. Our program is not designed to prepare you for any specific certification. Obviously, the topics that we are covering, the coursework is relevant. Like, there are many ways to prepare for particular public health related certifications. We are not narrowly structuring us to say like all of our students are going to go down this pathway and then prepare for this particular certification. And that's partially a choice that we make to give you that flexibility that I mentioned earlier. Like that you have the option to create highly tailored sets of courses to your particular interests. And that means that somebody may be getting a lot of expertise in one domain, and another different student may be getting a lot of expertise in a different domain.
I'm trying to, I think I missed one, but I'm not seeing it.
Did we cover whether there's an interview process? That was one that I saw.
Yeah, no, there is no interview process for our Masters of Public Health program. Admissions process for PhDs is handled separately. There is potential interviews, parts of that process with that. Jackie knows more because I am not the PhD admissions person. And the funding for PhD, the accepted applicants is handled as part of that admissions process.
Let's see.
Oh, yes. And Jackie noted in the chat, if you're admitted to the PhD program, you will receive 5 years of funding. That's part of how that funding happens is different for different people, but you will receive 5 years of funding.
Okay, and you answered Juliana's question about statistics or college level algebra.
Yep.
Okay, I'm not seeing anything more, I don't believe. Somebody, Meredith or Kieran, if you catch something, please feel free to call it out.
So I'll just vamp. I would say it's interesting seeing the alumni profiles that Kieran helped us to find. I know several of those students when they were here, and one of the interesting things is the discovery process that many of our students have when they get out. So there's what you think you are interested in while you're here, but you even heard from several of the alumni about how their career has evolved. Like that we set the foundation and then give you some skills, and as time moves on, people pivot. And that is part of what we are designing you to be ready to do. This is not preparing you for one job. This is preparing you for many jobs. What's the average age of incoming MPH HBHE students? Average is the wrong statistic here because this is a skewed distribution. I would say most of our students are coming within 5 years of having completed their undergraduate degree. Some are coming from directly. Many are coming with at least some work experience of different types. We do get a non-trivial number of people with more years of work experience, and often with very specific reasons why they're saying now is the time that it makes sense for me to go back and get a master's of public health degree, sometimes to pivot their career or to take it to the next level. And so anyway, that's, I can think of students who came back to us in their 40s. I can think of many students who are coming to us very quickly after undergrad. Do I prefer candidates who have a few years of work experience? Experience comes in many forms. So work experience is one type of experience that's relevant. If you don't have work experience, but you had relevant experience in extracurricular things while you were doing undergrad, if you have life experience that has oriented you towards relevant health issues, that counts too. So I'm not going to say you should have or should not have. We're going to look at all of those types of things. I'm not going to let Meredith answer her question. I'll even give you the space since you didn't get to introduce yourself as we're doing introductions. Why don't you unmute yourself and answer that?
Hi, everyone. I'm Meredith. I hopped on late, but I'm happy to be here and appreciate the questions. I'm a second-year dual MPH candidate in health management and policy and health behavior and health education. And I'm also the department assistant. And I'm very familiar with having university jobs. I've had many. If people want to connect via email, I'll put my email in the chat and can answer any questions. But I've been a research assistant. I'm a resident advisor in graduate housing. I'm an administrative assistant.
So what's your favorite part?
Lots of experience. What was that?
What's your favorite part of the program?
My favorite part of the program, specifically with HBHE, the people are just a different kind of person. And the reason that they're different is because they get it. And the it is like the subtle nuances of how the world works and how people work that other people don't fully understand. And they get it with compassion and they get it with care in a radical way. And they all just want to make change. And they don't just want to make it, but they're actually doing it. And that's the vibe everywhere you go in HBHE. And it's just so inspiring to be a part of it.
Wow, I don't have anything to say to that. Thank you very much, Meredith. That's wonderful to hear. So I'm seeing a few things in terms of the dual degree program with Jeanette Counseling. So I'm going to say a few things more generally. I think getting into the details of some of the specifics for dual degrees does depend upon what the combination is. So I'll keep it at a high level, and I encourage you to follow up with Jackie for some more specific detail. Like the dual degree programs, what works nicely is that basically what you take a 4-semester program and another 4-semester program and you smush them together into 6. So that you're doing 3 semesters worth of HBHE work and 3 semesters of whatever your other degree program is. How that unfolds is slightly different from one program to another. Sometimes it's very sort of structured. You're here for these semesters, you're there for those other semesters. Often it's sort of like first year's here, second year's here, third year's a mish. But it does depend upon the program. And a lot of our students who want to pursue dual degrees do so because they see obvious overlaps. You still have to take core coursework, even if it's slightly similar in one place versus another. I'll give you an example. The way social work thinks about program evaluation and the way HBHE thinks about program evaluation are not exactly the same. So if you're a dual social work student and HBHE student, you'd take both. But that's part of the learning, is coming to understand how these different fields are merged together in what you want to be doing. And we see that, Meredith's in health management and policy. We see people doing it in public policy. We see people doing it in social work, genetic counseling, and the overlaps are different in different places, but that's what's wonderful if that's something you want to pursue. But I will also say this, and the faculty have talked about this a lot. More is not always the right choice. Sometimes it is, sometimes it's not. So I don't want anybody to think, oh, I'm not doing everything I could if I only get one master's degree. You're getting a master's degree, like you're good. The right question is that the right thing for you? Any last questions? I see things flying by in the chat.
Not any more questions, but just want to let everybody know, feel free to reach out to me if you have follow-up questions. I'm happy to answer them. Kieran is your go-to though, if it's really anything about internships, Apex, other types of learning. She's the queen of that. And of course, reach out to Meredith if you have any student level type of questions.
And I'm not going to let her name everybody else and imply by omission that you can't reach out to me. The faculty are quite open to applicants reaching out to them. And if you see a faculty member who seems to be really interesting, doing cool work, I encourage you to shoot them an email. Now, I'm not guaranteeing response, like we're all busy people, but many times you will get a conversation, whether that's because somebody is doing community-based participatory research like Barbara Israel or Amy Schultz, whether that's somebody who's doing a particular topic like sexually transmitted infections, whatever. This is a faculty where we're having students and applicants reach out to us is something that we're very comfortable with. Well, if there's no further questions, I see we've run about 5 minutes past our time. Feel free to reach out to us by email to follow up with us. And otherwise, I hope you have a wonderful rest of your day. And I am looking forward, hopefully, to seeing applications from many of you in the months ahead.